Welcome back to another session of Modern Concept of Childcare. In today's session, we will learn that what are the principles of preoperative and post-operative care of infants and children. So we will talk about two phases here basically, that is before the surgery and after the surgery. So let us first understand what we mean by preoperative care. Now, as I told you that that before the surgery, right? So pre-operative phase means we know that it is the before it is a period which is before the surgery. So basically, in this period, the patient needs to be prepared emotionally and physically. And for that, whatever care we provide, that is considered as pre-operative care. And then we have post operative care, that is after the surgery. So, this is the phase which begins once the surgery is completed. And we know that surgery would definitely cause some sort of physiological stress. So to recover the patient from that, we provide care during the after the surgery. So that care is considered as post operative care. Now, before seeing that, what are the principles of pre-operative care and post-operative care? There are certain general principles that we need to keep in mind. So, let us see what are the general principles that we should take care of. So, the first thing is that as a nurse, what you have to do is you have to introduce yourself to the child and also to the family members. So you are going to tell what is your name, what is your role, and how you are going to take care of the child. So this is how you have to establish a relationship with them, with the child, and also with the family members. And you have to remember that whenever you are communicating with the child and with the family members, you have to be empathetic and you have to answer them in a respectful manner. So always you should remember that the principles of family-centered care. So as we've already discussed that in the current trends that we focus on family-centered care, right? So yes, so here whenever you are communicating with the child or with the family, you have to remember that you have to provide family-centered care and you have to present yourself in a in a very respectful manner and empathetic manner. And the next thing, you have to ensure that the child and the family members should be given opportunity to explore questions. So whenever the child, when the child gets admitted in the hospital for any kind of surgery, they should be before the surgery, or they should be given opportunity to explore all the questions. So whatever question comes to their mind, and they should be allowed to ask those questions, and they should, all the doubts and questions should be answered, should be clarified. And then you have to maintain the confidentiality and privacy. So, whatever information that you will be sharing with the patients and the patient's family members, and whatever information you would hold, you have to maintain the privacy and you have to maintain the confidentiality. And this is how you have to gain their trust and you have to establish the relationship with them. So these are the general principles that we need to take care of before any when we are providing care during any kind of surgery, that is before the surgery or after the surgery, or even if we are providing care during the surgery. So let us move to pre-operative care. So the phase when we have to prepare the patient emotionally and physically for the surgery. And here you have to remember that you are not only going to prepare the child, but also you have to prepare the family. The family members also need to be prepared. So first let us see the principles of emotional preparation. So first we are going to see how to prepare the child and the family members emotionally for the surgery. So in emotional preparation, during these any kind of surgery, whether it is minor or major surgery, the parents or the the patient, they would have a lot of questions, they would have a lot, fear in them. And mostly it is because of lack of knowledge, lack of knowledge about the surgery, about the procedures, how they are going to be taken care of. So the first thing that we are going to do is we are going to explain the procedure to the parents. And if you have an older child, in that case you can give adequate information to the child also, that if the child is able to understand, you can definitely tell the child that what is the procedure, what you will be doing, and how the child will be taken care of. So the child and the family should receive an adequate explanation for the procedure. And then you have to assess the emotional state of the child. So whether you have to assess whether if there is if the child is anxious, if the child is scared. So in that case, you need to take certain interventions. So for that, assessment is very important. So the first place, we are going to assess their emotional state, and then we have to eradicate the fear that is associated with surgery. And you have to remember that whenever you are talking to the child or the parents, you have to give them opportunity to express their feelings. If they whatever feelings are there, that is, if they are scared or if they are anxious, if they have any doubt, so they should be always allowed to express their feelings. And when you are answering to their questions, when you are clearing their doubt, you should be truthful and honest. So that is the way you can eradicate their fear. And then you can take the child and the parents, and you can orient them to the post-operative room. So this is also very much important, because many times they think that after the surgery, what is the next procedure, where the child will be, and this question comes, right? So that's the reason, in the pre-operative phase itself, we have to make sure that they are oriented to this place. So they are oriented to the post-operative room or the recovery room, and they would have the idea that after the surgery, where the child will be. And then you have to make sure that the family understand the estimated time frame for the whole procedure. So you have to give them the idea that how much time it is going to take, and if there is any delay, the family members should be informed. Also, you have to encourage them to voice any opinions they have, or any concerns or any queries are there. So this is what is emotional preparation. So this is how we are going to prepare the child and the family members emotionally. So basically here we have to assess the child and the family members. We have to assess their emotional state, the emotional need we have to assess. And then we have to communicate with them in such a way that they that so that we would be able to eradicate their fear, which is related to surgery. And each time you communicate with them, you have to make sure that you give them opportunity to express their feelings. So this was all about emotional preparation. Now next, let us move to physical preparation. So how we are going to prepare the child physically for the for the surgery. So as I think you might be aware that if there is any kind of surgery, before that NPO will be ordered, right? Nil per oral. So you have to check the status of NPO. So you should make sure that the child did not eat anything, because they are in a stage where they don't understand the importance of this particular procedure or whatever has been advised. So in that case, you have to be very cautious, and in the pre-operative phase, you have to make sure that the child did not eat anything. So the first thing that we are going to do is checking the NPO status. And then if enema has been ordered or has been prescribed by the doctor, we have to administer the enema. So after that, we have to provide bath to the child. So this is to prevent any kind of micro presence of microorganisms in the body. So we are going to provide bath to the child, and then we are going to give a clean hospital gown to the child. So basically that will be a surgical gown. So we are going to provide that after the bath. And also we have to obtain the legal consent from the parents. So before taking the legal consent, definitely you have to explain the procedure, the risk associated with it, and what are the benefits if the if the surgery will not be done, what are the complications that might occur. So everything should be explained clearly to the parents, and then you have to obtain the legal consent from them. And whatever reports you have, all the laboratory reports and x-ray films, everything should be attached with the patient's file, and you have to send that along with the patient to the OT. And then you are going to check the vital signs of the patient. And if there is any abnormalities present in the vital signs, that you have to report to the physician. Also, sometimes there will be pre-operative medication prescribed by the doctor. So if there is anything like that has been ordered, then you have to administer the pre-operative medication. And then before transferring the child to the OT, you should make sure that you check the identification band which is tied on the wrist, and it should match with the patient's profile. So this is to confirm that you are having the right patient. So you should not forget this, that before you transfer the child to the operative room, before that you need to check their identification band, and then you can escort the child to OT. Now during this shifting, shifting a child from a ward to OT is also involves a lot of procedure. We will not go into much depth, but we will see that what are the major roles or major things that we are need to do, we are supposed to do when we are shifting the child. So during the shift, what we are supposed to do. So you should allow the so you should allow the mother to you should allow the mother to accompany the child to at least to the pre-operative room or the pre-operative area. So you can definitely allow the mother or the parents to accompany the child till there. And you should ensure that the parents knows that where to wait when the child is in the operating room. So when you are shifting the child, you have to make sure that the family members or the parents, they know that where to wait for the child when the child is in operating room, or from where they would get the information that what is how the surgery is going on. And then you have to show them where is a post anesthetic care unit located. So when you are shifting the child to OT, you have to remember these points, and you have to do this. So this is what we are going to do in the pre-operative phase. Now next, let us move to the post-operative phase, where the surgery is already completed and the patient is on the recovery room. Now here we have some immediate post-operative care. So basically, when the child is in the recovery room, we need to provide immediate, post the moment the child is transferred, shifted to the recovery room, we need to provide certain immediate care. So what are those? So the first thing is that we have to check the level of consciousness. Now, as the child was administered with anesthesia, we have to check whether what is the status of the level of consciousness of the child. And then you have to check the respiratory rate and pattern, and also color and perfusion of the child. Then we are going to check heart rate, pain score, and if there is post operative nausea and vomiting. And in certain cases there might be you have to observe, there should be neuro observation. So that will be ordered by the doctor. So if it is applicable, then you have to do neuro observations also. And then you you have to check the temperature of the child. So these are the immediate care, we can say that we have to give when the child is in the recovery room. Now we say now we said that we are going to check the pain score, and you know that after the surgery definitely the child is going to have pain. So for that, what management we are going to provide, that we are going to see now. So what are the pain control management that we can do in the post operative phase? So whenever you are assessing the child, and at each observations you should assess the pain score of the child, and then you have to administer the analgesics if it is prescribed. So once you are administering the analgesic, it is very important to reassess the pain score after providing the analgesic, so that we would come to know whether the analgesic is working or not, and whether if the pain is very severe, and it is if it is not reducing. And if you find out that even after giving analgesics the pain is not reducing, then you have to seek medical review. So you have to inform to the doctor. But before that, we can do some sort of things such as providing comfort measures. So utilize the comfort measures that you have, and that should be appropriate to the child's condition. And then we have the diversional therapies. So based on their age, based on their developmental age, we can use any distraction method. We can give them any kind of diversional therapy. So this is how we are going to take care of the pain. So basically, this is how we manage the pain in the post-operative phase. Now there will be certain concerns related to surgery, and now we are going to see how to take care of those concerns. So the first one is potential for infection or hemorrhage related to the condition. So mostly after the surgery, patients are prone to infection. So we have to manage that in the post-operative phase. So for that, as a nurse, you should check the wound regularly. There should not be any leakage from the wound. If there is any changes in color of the wound, so that you have to report to the doctor. And then if drains are there, you have to ensure that the drains are secured properly. And if you find out that the integrity of the drain is compromised, then you have to replace the drain. And each time you do this observation, you have to measure the drain output, and you have to record that on the fluid balance chart. Also, you can administer antibiotics if it is prescribed, and then you have to do a continuous observation for any sign of infection. So if you find there's any redness, inflammation in the site of surgical site, then that might indicate infection. So you have to provide a continuous observation. And the next common thing is potential inability to meet own hydration needs. So here your role is that you have to promote oral fluids, and you have to ensure that the child has passed urine after the anesthesia. Next, administer intravenous fluid as it is prescribed, and assess and documents the hydration and fluid balance. So this is what we are going to do for the hydration. The next one is anxiety related to hospitalization or the procedure. So as a nurse, you should encourage the family members to ask more questions, and you have to empower them to be to be involved in the patient's in the child's care. And whenever you are doing any procedure for the child, make sure that you explain it to the parents, and you involve them in the child's care. Next is you can involve a play specialist, and you have to make sure that the call bell is readily available so that they feel secure. So these are some general concerns that we see. It is not based on any specific conditions. It is generally these are seen after any kind of surgery. So this is how we are going to handle it. Now the next thing is that we have to prepare the child and the family members for the discharge. So when you are preparing the child and the family members for the discharge, you should ensure that the pain is well controlled with the existing medications. And then you can inspect the epidural site for redness, or if there is any swelling present. Also, you need to inspect the wound and the dressing prior to discharge. And then coming to the part where you need to provide education. So you have to provide education about the medications. So you need to explain them what is the time, what should be the time of administration, and how important it is to complete the course of the antibiotics. And when you are explaining these things, you have to make sure that they understand that when to give these prescribed medications to the child. And then you can provide them with and then you can provide them with discharge information sheet relating to the child's condition, and ensure that the family have a written discharge information and a follow-up plan. So you have to advise them for the follow-up, so that they take the child or they bring the child to the hospital for follow-up. So this is how we are going to prepare the child and the family members for discharge. Well, so that was all about pre-operative and post-operative care, basically the principles of pre-operative and post-operative care for infants and children. I hope you have got a better insight about the topic. Thank you.